Hello, everyone. Can you hear me? Hello, everyone. Can you hear me? Okay, we have small technical problems because I can't put my presentation into this Click Meeting program, but I will share with you my screen. Okay, so let's start. Because I turned this, let's say I turn myself on my phone because I can't see myself during the presentation, but now I can hear myself too, and it's quite strange. So I will turn off my phone, what means I can't see the questions you will ask. So I will ask Richard to take care of questions. And if you will have any questions, Richard, please write me a message, and I will then turn on the question. And I think we have to do this like this. So once again, let's start the presentation about the diagnostic portfolio of VetExpert. The first part of my presentation is the technical issue and technical things about the rapid tests. It will be quite boring, so please don't run away because after the technical part will be more interesting. And so after the technical things, I have some information about tests. I will start with the CaniV4 test and Leishmania. And I decided to say a little bit more about few tests, and a few tests I will just like jump through because we have a plan to make in the future presentations like in details about some tests. So then I will tell more about each disease and each test. So I choose some tests that I think will be more interesting for you, and I will tell more about this test and it's how it will look. I think we will start to do it without break, but if you will need a break, just please write to Richard and he will tell me, and we can make a break then. If we will have problems with questions, we will just make the part with questions at the end of this presentation. Yeah, okay, so let's go. So VetExpert rapid tests are based on immunochromatography method. What's important is just qualitative tests, so weekly stained line is also a positive result. We have a possibility to detect antibody or antigen. These rapid tests give us quick result and diagnose in 10-15 minutes. They are based on gold-labeled monoclonal antibodies. And what's important, we can store it in the room temperature. So immunochromatography assay, we can detect antigens or foreign substance, or antibodies, so it's the response of the body to the antigen. Okay, and what's inside? This is the picture I made in a paint, so it's quite simple, but I wanted to show you what's inside this display. So in here, we have a hole where we put the sample. It can be blood or feces, or I mean the feces in the liquid, so it's liquid with feces. But we put sample in here. And here we have this part with colloidal gold label antibodies. And then this is the window with the result. We have T line, which means the test line, and C line is the control line. And this is the picture from Google, more professional than my picture, but than my paint. But here I wanted to show you what's inside. And so T-line, it's the line where we can find antibodies against this colored label antibodies. And sorry, C-line, it's antibodies against these antibodies. That's why it's always very well stained. And in here, test line is waiting for the antigen that we are looking for. And at the end is absorbing part, which is taking the liquid. We have to remember that immunochromatography method is a wet method. So we can read the result only when the plate, the test is wet. So it's time of 15 or 20 minutes. In here, the negative result, we put the sample into the hole, and there is no disease, let's say. So we only have these complexes of antibodies with the antibodies in here. So only what we can see is the C line and test is negative. And the positive result, we put the sample. We have our antigen. This antigen is making the complexes with these gold labeled antibodies. And after that, it's binding in here to the anti-antigen antibodies. So we can see the T line also. And control line is always the same. So we have the control. I hope it's clear and all of you understand what I mean. Okay. Once again, about the immunochromatography assay. Point of care tests. What's interesting, it was firstly used in 80s of 20th century. So it's quite young method. But I think it's very often enough to detect the disease and to detect our to use it in our clinic. It's looking very simply because it's just a plastic. But inside this plastic, we have to remember that we are using the gold label antibodies. So it's quite high immunology technique. And we can, it's like easy to use diagnostic device that we can confirm the presence or absence of the disease. What's important in the human medicine, the most common test is a pregnancy test. And when we think about it, when we have 2 lines in the pregnancy test, everyone believes on the result. So it's enough to confirm the pregnancy. So the pregnancy test, but also there is a like point of care tests to detect flu, strep throat, or a respiratory system virus in kids. But also COVID-19, we can find on the market the antigen tests and also the antibodies test. Okay, so tests are based on the on immunocomplexes of antigen and antibody. That you could see this on the picture before. And the control line is always very well stained because all complexes are filled. So it's always very well colored. And T line depends on how many antibody or antigen we have in the sample. Because many vets are asking if there is a weak line, if it's positive or if it's not. So the answer is if there is a line, even if it's very weak, it's still positive result. So we have to remember that it's qualitative test. So line is the line, and line means positive. Okay, and 2 difficult things to remember. The sensitivity is a true positive rate. So it's a ratio of all true positive results to all results we have. It means the high sensitivity of the test is a low risk of false positive result. And specificity is the ratio between the true negative to all negative results we have. So high specificity is a low risk of false negative results. So sensitivity is to confirm, and specificity is to like eliminate the risk of this disease. And in VetExpert portfolio, we have two types of tests. The first type detecting antigen, so the infectious agent. And I used it all tests in here that we have in portfolio. So we have adenovirus, distemper virus in dogs, of course, the parvo, feline leukemia, feline parvo, so panleukopenia virus, coronavirus in cats, Giardia, CIRD. It's the, I will tell about this test later. It's for the respiratory diseases in dogs. Heartworm AG, Cryptosporidium, Clostridium, and Bovid-4. It's for cattle. Yeah, and detecting antibodies. So the body's response, we have feline immunodeficiency virus, we have coronavirus of feline also, Leishmania, Brucella canis, Lyme disease, so Borrelia, Ehrlichia canis, and total IgE, it's for the allergy. I also described this test, and I've got few slides about it later. And Toxoplasma AB. And we also have mixed one, and it's the Canif4 and Canif4 Leishmania, because you have also antigen of heartworm in this test, and 3 diseases with the antibodies. What we have to remember, the test detecting antibodies, we can perform only from blood. So the sample is blood, and detecting antigen, the sample is the material where the problem is. So it can be blood, for example, for FELF. It can be feces for Giardia, Cryptosporidium, and other tests. It can be swab, like for this distemper virus, or even urine. Also, distemper virus can be performed from urine. Okay. Frequent problems. We are almost in the end of the technical part. Frequent problems, in my opinion and in my experience, we have more often technical problems with the antigen tests. And what problems we can face? So too much feces or blood, and the test is clogging and doesn't want to take off. And the other thing is bad picking moment. So we are looking for the disease which is not now. I mean, for example, with feline leukemia, the test is looking only for viremia. So where there is no viremia, for example, we have the latent phase of the disease. The rapid test is not a good test to detect the disease, and then we have to perform PCR. Also, parvovirus, I have slide about the parvovirus detection and time of detection. I will tell it later, but we have to remember that the parvovirus, the highest level in the feces, is in first days after first clinical signs. So if we perform tests after, for example, 5 or 7 days from the beginning of the disease, we can just dismiss the antigen. And the last thing is post-treatment examination, and the problem sometimes appears with the Giardia test. We have to remember that we should wait about 10-14 days after the treatment and then recheck. Because if we will check earlier, we can have false positive results. And in this picture, we have information how much feces we could take on the swab to perform the test perfectly. So good is in here. And frequent problems with antibody tests. It's more rare, I think, with these tests. So the first thing can be like the time when the antibodies appear. So we have to remember that from the start of the infection, and our body needs 7, sometimes 14 days to make antibodies. So right after the infection, we can just don't have antibodies, so the test result will be negative. Yeah, and this once again about the color of the line, and because it's one of the most common and very often question, so thin line is a positive result. Okay, and the portfolio of our tests. We will start with the VetExpert Canif 4. I choose this test because it's our best seller, and not only in Poland but in other countries too. There are 2 variants because we have Canif 4 and Canif Leishmania, and the only difference is the Lyme disease. So in Canif Leishmania you don't have Lyme, you have Leishmania, and in this Canif 4 we have Lyme, and we don't have Leishmania. Why? Because what's very interesting, in the south part of Europe we have Lyme disease, and I mean in north part of Europe we have Lyme disease, and in the south we don't have it, even if the bacteria exists in the and ticks that transmit Borrelia exists on the southern Europe, but the disease doesn't exist. No one knows why, and scientists still can't answer on this question. Okay, few words about ticks. So this is the tick, and what we can see, the breathing hole is located behind the last part of legs. You can find it in here. And here this hole is genitals and anus in here. And here we can see the microscopic view of this tick, of the tick. And on this picture with the human finger, we can see the stages of the tick. And the smaller one is a larva. What's very interesting, the larva has only 6 legs, and so we can don't even think it's a tick, but it is. And some of diseases can be transmitted even by larva. And here is a nymph, and it has 8 legs already. It's quite a little bit bigger. And then it's a female tick and a male, but adults. What's very interesting, to transform from larva to nymph and from nymph to the adult, tick needs 3 hosts. So the adult tick could be in his life on about 6 or more animals or human, and could like travel around the world. It's possible. So please remember about the larva and 6 legs, because it's quite important. And hard ticks, I put on this slide the ticks that we have in Europe and we have in Poland, because the Polish market is the closest market to me, and I know about this market more than other markets, and I know more about the diseases that we have in Poland. But I would like to ask you to share with me and with Richard mainly, because he's a connection between you and us, to share with us information about your markets and about the diseases that you have, and then we can like modify the presentations, because I just need to find some information about your markets and your diseases, and it will be like better to prepare the presentation for you. But at this moment, I base on the European situation and Polish situation. So the most common tick we can find in Poland, but also whole Europe, is Ixodes ricinus. It's this one. Then the second tick is Dermacentro reticulatus. This one transmits Babesia canis in Poland and Europe. Rhipicephalus sanguineus, it's a dog tick, it's the other name of it, and it's the African tick, but it like moves to Europe, and it's difficult to find information that it exists in Poland, but what we know, we have diseases transmitted by this tick. So I believe it's sometimes we can find it in Poland also, but mainly it's in Mediterranean Sea region. And the hedgehog tick, it's just to show you the difference between the ticks. It doesn't transmit any of the disease that we will talk about today. Okay, Ixodes ricinus, so Lyme disease, inter alia Lyme disease. As you can see, whole Europe. But as I mentioned before, Lyme disease doesn't appear in the southern part of Europe, even if the tick does. So it's quite interesting. Dermatocentro reticulatus, almost in whole Europe. An example of Poland, what you can see, it exists only in the part of Poland. And that's true because the main disease that it transmits, so Babesia canis, we have only in these regions, and we don't have Babesia in other regions of Poland. Rhipicephalus, so southern part. This is here we have Poland, and we don't have it marked, but believe me, we have diseases. So the name of this tick, the other name is kennel tick or dog tick. It's because it attacks mostly dogs and not other species. Okay, and about the Canifor test. So it's the test to detect vector-borne diseases. These diseases can be transmitted by mosquitoes. So Dirophilaria immitis in Canifor and Leishmania infantum in Canifor leish. So detects antibodies. And transmitted by ticks, so Borrelia burgdorferi, so Lyme disease, Anaplasma ehrlichia canis. And it detects antibodies against these diseases and antigen, antigen of Dirophilaria and antibody of Leishmania. It's a quadruple plate. Why? Because the clinical symptoms are like similar. There are no specified for any of these diseases. It can be fever. Sometimes it's joint pain. So it doesn't mean that it's exactly this disease. So, but the clinical symptoms are quite similar. And laboratory symptoms, we have thrombocytopenia and anemia. Okay, and a few words about each diseases. And let me start with Dirophilaria immitis. I have to tell you that we don't have Dirophilaria immitis in Poland because it's too cold in Poland, and we don't have the mosquito that transmits this disease. But the final host is bitten by the mosquito and becomes infected with the larva, which is known as the microfilaria. The larva is in the mosquito's intestine, transformed into the invasive L3 form, and it invests to the dog, for example, and penetrates the dog's skin and transforms into the L4, and after that in subcutaneous tissue to L5. And L5 passes to the muscles, blood vessels, and finally to the heart. The major worm located in the lung and big vessels. The period of this journey can last about 6 months. Here on the picture, in here we can see the microfilaria in the blood. The main difference between the microfilaria of Dirofilaria immitis and Dirofilaria repens is that Dirofilaria immitis has two ends sharp in here. Sometimes it's difficult to diagnose if it's the microfilaria or if it's, for example, artifact as a hair. So you can just have to move the in the microscope, and the microfilaria is next to the red blood cells. Here we can see the red blood cells and leukocytes in here. And in this picture below, we can see the adult worms inside the heart, and it's quite disgusting. But a few words about the Dirofilaria immitis. It's called heartworm because it's located in the heart. And the major worms can reach to 30 centimeters. It's quite long. Females give birth to larvae that circulates into the body. The other interesting thing is the higher number of larvae, the microfilaria, we can find in the evening, because in the evening we have mosquitoes. So larvae are not stupid, and then they don't want to like spend whole day in the blood waiting for nothing. So they are just like they appear in the blood in a higher number in the evening, so in the time when the mosquitoes are attacking. The worms are very smart, I have to tell you. So what we can find in the blood smear is microfilaria and adults in vessels. It can't be confused with Dirofilaria repens. It's a worm of the subcutaneous tissue. And as I mentioned, Dirofilaria immitis we don't have in Poland, but you can find it in the Mediterranean region. And what detects the CANIV4? The CANIV4 test detects the antigen with a size of 14 kilodaltons. And it detects the juvenile as well as adult females and males. So there is no risk of false negative results when we have the invasion of only males or immature females. And yeah, I said before about the regions where you can find this disease. Once again, the blood smear, but here it's the microfilaria of Dirofilaria repens, because it's me who made this picture. Okay, I will make a short break because Richard just wrote me that we can use the presentation because we have it in the program. So I will see questions. So I will just turn off the presentation for a second and return in about 2 minutes, okay? Okay. Okay, I'll jump to the slide of this Ehrlichia. Now you can see the presentation as well. Yes? Okay, perfect. I see the question about the presentation, if I can share you. Yes, of course. I think you can even download it from the program. But yes, Richard will send you this presentation. And you can use it however you want. You can change it and other things. And also, I will share with you the presentations in the future that will be more detailed about the diseases. Okay. Okay, so Ehrlichia and Anaplasma. And initially, these bacteria were not distinguished. Ehrlichia was firstly described in Algeria in 1935. And 20 years later, it was a huge problem with this disease during the Vietnam War. And initially, it was named as a tropical canine pancytopenia, and later it was renamed as a monocytic ehrlichiosis. In 1978, in the US, and the disease similar to this, but involving the plattles, was described. And it was named by the Ehrlichia platys, and now we know it's Anaplasma platys. And in 1982, the third disease was described, and it was Anaplasma phagocytophilum. And I made pictures with these diseases, with morullas in blood smear. So on the first picture, you can see Ehrlichia canis inside the monocyte, because this is the monocyte, and in here we can see the little dot, it's the Ehrlichia, and red blood cells. In the picture in the middle, we have Anaplasma phagocytophilum. What we can see in the middle is the neutrocyte, and the very small dot in the middle is the Anaplasma. And the third picture on right, we can see plattles, and inside it we can see the small bacteria, which is Anaplasma platys. So as you can see, it's not very easy to distinguish this bacteria. Okay. Now I can't change the slide. Okay. And Ehrlichia canis, the test, in the cani before, we can detect antibodies against the Ehrlichia canis surface proteins. The antibodies appears after 7 days, but in some dogs, it appears after 28 days. It depends on the dog. So it's no one knows when the antibodies will ready to be found by the test. So in this time, between 7 and 28 days, we can have false negative results, even if Ehrlichia is a disease that we have. And if test is negative and dog is suspected to be a positive, it's recommended to retest after 3 to 4 weeks. And a few days after the infection, it's the same in Ehrlichia and Anaplasmas, we can find the bacteria, morula, in the cytoplasm of the cell in the blood smear. And again, on this picture, you can find the monocyte with the small dot, which is the morula of the Ehrlichia. However, still, if you want to if you want to confirm the active disease, it's recommended to perform the PCR test. And more information about the Ehrlichia, the most vulnerable breed is German Shepherd. And asymptomatic dogs can be a source of the spread the disease. And what's important for us, so we know that detection is possible after 7 or 28 days. And we also can do the monitoring of the treatment after 3 to 9 months from the start of the effective therapy. And positive results on low titration of immunofluorescent assay. Here there is a comparison, and the sensitivity is more than 98, and specificity is about 100. Okay. Anaplasma, the test detects antibodies against the Meyer surface protein of the bacteria. We don't know if the test is looking for the Anaplasma phagocytophilum or platys. It doesn't distinguish these diseases. Antibodies are detectable after 14 days, so 2 weeks, and also in the blood smear you can find the morula. Here we can see the comparison with the immunofluorescent, and the sensitivity 96, specificity 99. And what SAVA recommends us how to proceed when we have the positive result of the test, because in Anaplasma you can't do the monitoring of the treatment because the antibodies can be persist the lifelong of the dog, and even if the disease is not active, we can find antibodies. So we don't exactly know if we are looking for the antibodies because the disease is was in the past or is active. So SAVA recommends to do like this. You have the positive result of the test, rapid test, plus we have clinical signs, so we can have laboratory signs, or we can have, for example, fever or joint pain or other things. We can enter the treatment. It's a doxycycline treatment for 2 to 6 weeks, or we can confirm by PCR and just after that enter the treatment. And if we have the positive result of the test, but we don't have clinical signs at all, we can we can treat the dog as a healthy, and we can also treat the dog that it has the antibodies after the illness, and it doesn't mean there is an active disease. Of course, we can also confirm by PCR, but PCR is quite expensive, so not everyone wants to do this. Okay, now the Lyme disease. So the disease from the northern part of the Europe, and it doesn't exist in the southern, but it's the most common disease in Poland. So I know about this disease more than about other diseases. And the test detects antibodies against Borrelia burgdorferi sensulato. And among European countries, the biggest problem is in Poland, in Slovakia and Slovenia. And what's important, dogs are usually asymptomatic. In some dogs, we can have joint pain also, or renal failure in Lyme disease, but it's not very common. So what we have to remember that dogs are the reservoir of the disease. However, the main reservoir is wild animals. And what's interesting, wild animals doesn't have the disease, so there is no clinical signs at all. They just transmit the disease to other animals. The most sensitive breeds are Labradors, Golden Retrievers, and Rottweilers. In dogs, we don't have the erythema migrans. I made the picture of it. It's, of course, the human. And what's interesting, erythema migrans can appear in cows, but because of the fur, we don't see it very good. But it's the only species in animals that the erythema migrans can appear. Lyme disease is very difficult to diagnose and it's very difficult to treat because Lyme is running away from the diagnosis and running away from the treatment because it's changing the proteins on its surface. So this is the test with the lower sensitivity in our portfolio because it's only 93%. So the false positive results are possible in here. And the outer surface proteins, it's not only in dogs. In humans, we have the same proteins. The OSPC, it's in here. You can see the mark that I'm showing on this presentation. I don't see any questions again. Yeah, okay, perfect. So OSPC is the protein of the first phase of the disease. So it's not very good to use in the diagnosis because it appears and after that it disappears. So if we'll be in the time of in here, so if we'll have tests based on the OSPC, you can just dismiss the disease. And then we have the protein C6, which is the best protein to detect, and our bigger competitor with the tests with another method. They use this protein 6 and they have patent on it. However, it's the best test, the best protein, because it appears about 30 days. It's C6 in here. 30 days, and it disappears after 2-3 months of the effective therapy. And our test used the OSPF, so it appears after 42 days. And also you can do monitoring of the treatment, but 3 to 4 months. So this is the main difference between our test and the main competitor. I don't want to use the name, I'm sorry, but I think you know what I mean. So the main difference is the other company tests 40 days when can detect the Borrelia, and we have 42 days. And monitoring of the treatment, they have 2 to 3 months, and we have 3 to 4. So it's the main difference. So okay. And how to use the Canif4, how we explain to our market. We try to ask vets to perform it when they have clinical signs, but also to repeat after 4-5 weeks. Why? Because we have the detection of the Lyme disease from 42 days. And we have this gap of the antibodies in Ehrlichia, this from 7 to 28 days. So it's good to repeat this test. And on the other hand, we ask them to perform it to each dog, even asymptomatic, once per year, because most of these diseases are without any signs. And these diseases are dangerous for of course, animals, I mean dogs, but also humans. Canif4 is only for dogs. Off the record, I can say that anaplasma you can perform in cats also, but there is no big problem with anaplasma in cats. Okay, and few words about Leishmania infantum. What you have to know, we don't have Leishmania in Poland, so this is not the disease that I know very good, but I will learn. If you will ask me questions, I will find the answers. So the rapid test is one of the methods to detect the Leishmania. However, the most commonly used method is skin cytology. And on the picture, you can see this is the skin cytology. This is the picture I made, but it was only once when I saw the leishmania in my life. And the leishmania, the amastigota of it, it's this small dots. It's very, in my opinion, it's very easy to detect because it's very characteristic. So if you do the skin cytology and you know how it looks, it's impossible to dismiss the leishmania mastigota. Here we have lymphocyte and red blood cells. What's important? Some dogs can have no clinical signs, but most of them have skin like disorders. Yes, yeah. The VetExpert test use a recombinant kinesis complex to detect anti-kinesin antibodies of Leishmania infantum. Antibodies are detectable after 2 months of the infection. There is no interference with the Leishmania vaccine because the VetExpert test doesn't detect antibodies which we have in vaccines. Okay, and comparing to the immunofluorescent assay, we can see that the sensitivity of this test is 95.6% and specificity is 98%. So again, we can have some false positive results. However, in my opinion, it's better to have false positive than false negative when detecting the disease like this. And here we have a table with the vector-borne diseases. I put the Leishmania here too, and we have Anaplasmas, Borrelia, Ehrlichia, Porphyria. We have the vector, so sandfly. What's interesting in here, look, we have Ixodes in here, we have Ixodes in here, and we have Ixodes in here. And I had 5 cases in a field in Poland, and 5 times vets sent me a picture with 3 diseases positive, and they were asking if it's false positive, but it wasn't. It was just the Ixodes fault. And transmission time. At the moment of the bite, 46, 48 hours, 46, 48 hours, about 24. However, there are some data that the time can be shorter. And Ehrlichia, 3 hours. It's very, very, very short. Clinical symptoms and laboratory symptoms. This table you can find in the catalog of the diagnostic of VetExpert. So I will just go further. And here the monitoring of the disease. Anaplasma, detectable from day 14. We can't do the monitoring of the treatment because it can be positive for the whole life of the dog. About 40 days Borrelia, and after 3 to 4 months we can do the monitoring. Day 7 to 28, and after 3 to 9 months we can try to do the monitoring of the treatment. Okay, this is the end of the Cani V4 test. I can say even more about these diseases, but I think it will be too much for today. But I will prepare I have the presentation for you with more information about this test, so we can do this later. And now fifth valve. I have just few slides about fifth valve because these diseases are also very complicated. I mean, valve, the diagnosis, and and it's not very simple. So I didn't want to today to say about everything, and I just want to leave it for later. So today just few words about the fifth valve. Okay. Feline leukemia virus, it's again about Poland. It's the most common disease in Poland. It's caused by the feline leukemia virus, a single-stated RN virus, retrovirus. What's interesting, it can consist of several genes, but not among the oncogenic. So if there will be the cancer, I mean leukemia, it doesn't depend only on the virus, but on the cat. And if the virus will bind to the oncogenic tissue. Okay. The RNA is closed in the capsid in a lipoprotein covert. The protein P27 of the capsid, we are searching by rapid tests. And proteins, this GP70 and P15E, are used in vaccines. So if there is a question if the test can be positive after the vaccination, no, because we are using another protein in test and in another proteins in vaccines. So again, antigen P27, we are searching by tests, and test can diagnose only viremia. The other phase of this disease can be a latent phase, and we can diagnose it by PCR provirus or PCR DNA FELV test. Only cats with the negative rapid test and negative PCR can be considered as free from leukemia. Leukemia, sorry. And again, vaccination do not affect on the test result. Feline immunodeficiency virus test detects antibodies. What we should remember is that antibodies can be detectable after 6 months after infection. So please do not test kittens younger than 6 months, because it's a big mistake. And fifth is incurable disease. So if cat has fifth, it will has fifth for the lifelong. But it doesn't mean the cat will live short, because some cats with fifth can live for many years with very good clinical condition. And important thing regarding the diagnosis of this disease is that the PCR method to confirm fifth has to include the 5 subtypes of fifth. So sometimes when we do the confirmation of the disease using the PCR, we can dismiss the disease because the PCR doesn't include all primers for all 5 subtypes. And the reference method to confirm fifth is Western blot. So it's better to use this method than the PCR. Okay, and conclusions about fifth: affects older cats, mostly males, long duration, and it can lead to scabies, demodicosis, and mycosis. So if we have these diseases, I mean scabies, demodicosis, mycosis, in kittens, it's fine, because it's because of the lack of the immunity, let's say, because of the young age. But if we have these diseases in older cats, old cats, we should check the fifth. It doesn't directly lead to the death, so the cat with FIV can really live for a long time. But FIV positive cats should be kept away from other cats. It's the lentivirus virus, so it's the same group with HIV in human. And the RNA of this virus integrate with the host cells. Occurs only in the latent phase, so we can't find the antigen in blood because this virus, the antigen, it's in the lympha. So we can't easily find the antigen in the blood. Okay. The provirus slowly multiplies in the host cells of the immune system, so macrophages and lymphocytes. And first clinical symptoms, if appears after even many years from the infection. And now we are jumping to diarrheas in puppies and kittens. So we will have quite a lot of tests to explain now. Let me start with the Let me start with the comparison between the parvovirus and coronavirus. I think this table we can find in the catalog of the diagnostic tests of VetExpert 2. So what we have here, age of the dog, younger parvovirus, and older coronavirus. Breeds, all. Infectiousness, yes. Mortality, it's high in parvo. It's very low in the corona. It's not COVID-19, okay? It's the other corona. It's the coronavirus, the enteric coronavirus in dogs. Also cats, coronavirus. It's not the same as SARS. Okay. Body temperature. We have fever in here. We don't have fever here. Leukopenia is very frequent. The higher leukopenia, so the lower number of white blood cells, we can find in cats. But in dogs also we have leukopenia, but not that significant as in cats. Feces, we can play in colors and consistency, but I don't want to do this. Response to rehydratation is quite long, and it's like very fast. Complications, no complication here. Hypoglycemia, acidosis, and other thing, immunosuppression, sepsis, and the sepsis is the disease that is killing the puppy and kitten. Relapses, no relapses because there is a immune response, and here also the immune response is enough. And the most important information is in here. CPV damages intestinal crypts, so penetrates very deep into the intestine and can significant damage the structure of the intestine. And CCV, so coronavirus, and destroys the enterocytes and villi, so it's more superficial than CPV. And in this table we can see the rate of mortality and recovery. So we can see in CCV the mortality is almost zero, CPV 50%, but and this is the answer why we have duo and triple test CPV CCV, and the mortality is almost 90%. So it's good to know if with the CPV we have CCV or no. And this is the answer why we should do the this triple test. I mean CPV, CCV, Georgia. Okay, Infection cycle, I don't want to describe it now, but what I want you to see is the whole intestine in here can be the parvovirus attacks. Also in some puppies, it can attack the heart muscle. And the CCV, as you can see, just the part of the intestine. You can see this, parvo, whole enteric, let's say, system and heart, and CCV just the part of the intestine. Okay. And this is the very important slide that I mentioned at the beginning, because here we can see the days post-infection. This is the first day, and this is the spreading the antigen. That antigen is in the feces, and on yellow the clinical signs. So diarrhea starts in here. And we can easily see that the highest number of antigen in the feces are just in the 1 day before the clinical signs, so diarrhea. And what happens very often? The puppy starts to have diarrhea. The owner is waiting because it believes it will stop. And here the owner is still thinking very often and coming to the vet on the 3rd day of the diarrhea. And sometimes the owner says that diarrhea is just from the day before. So vet is waiting 1 day and the number of the antigen can be almost undetectable by the test. That's why it's so important to perform the test as soon as possible from the first day of the diarrhea. So just remember about this, because it's the answer of the question why the puppy has clinical signs, and in morphology there is a leukopenia, but the test is negative. So it can be negative when we have about 7 days from the beginning of the diarrhea. And vaccination do not affect on the test results. However, in some leaflets of the vaccines, you can find the information that during 7 days post-vaccination, the rapid test result can be positive. I don't argue, but we don't. There is papers that the VetExpert test doesn't detect this after vaccines antigens. But in cats, the test result can be false positive even after 3 weeks. But the cat doesn't have diarrhea, yes, because diarrhea should be interpreted as a problem. Okay. Now we jump to the cat and feline panleukopenia virus. What I want to tell you is that this virus shared the same origin as the canine parvovirus. And following strains can cause the disease in cats. So it can be the original feline panleukopenia virus, but also canine, the CPV, 2A, 2B, and 2C. So the test feline FPV, detects all viruses. So FPV and CPVs. And dogs can only be affected by the canine strains. All parvoviruses are highly resistant to external conditions and disinfectants. So it's very important to predict the spreading of the antigen to other animals, and to be extra careful about the disinfection. FPV clinical symptoms: incubation 2 to 10 days, usually 3 to 5. Vomiting, fever, dehydration, diarrhea, sepsis, and death. it's very often situation. Laboratory symptoms. Here in panleukopenia, the white blood cells is going down rapidly and dramatically, and it's not the mistake that in the morphology you can find the 0.5 level of the white blood cells. Yes, it's the feline panleukopenia virus. And on the picture, you can find the positive result of FPV. Okay, I'll answer the question of Ali in a minute. Ending the FPV. What's important? To perform the test as soon as possible after the clinical signs. Vaccination in cats 3 weeks can be positive result, okay? And species-specific test should be used. Why? And answering the question of Ali, once again, FPV test, it's a little bit more expensive, as you probably know, can detect all parvo. So FPV, but also CPV, 2A, 2B, and 2C. So all strains of the CPV test. And CPV, so canine test, the test for dogs, only detects the CPV tests and skip the FPV. So if you use the CPV test in cats and the cat has the original panleukopenia virus, you can have the false negative result. So if you want to use the one of these tests to 2 species, then take the FPV test to dogs and to cats. But I shouldn't tell that, it's like off the record, but I know situations that vet doesn't have the like species specified tests. So in some cases, I even recommend to perform the dog test in cats, and because it's better to perform than to not do any tests. But we have to remember that in CPV we don't have the original panleukopenia virus. Okay, that's clear. Okay, and feline corona virus, I would like to start with the information that it's not the SARS-CoV-2, okay? So this test cannot detect the COVID-19 because I had many questions about it, and no, it's not, so you can't use it. And so about the feline corona, we mean the enteric coronavirus. It's the virus very common in cats. Especially the cats kept in larger groups and in house, and so in shelters and breedings. It can cause the temporary diarrhea, but it doesn't have to even have any clinical signs. And also mixed infections, corona and panleukopenia, are more serious. Yes, so the treatment should be more aggressive, and so it's good to know when we have the panleukopenia if we have also the corona active or not. There are some things we can do to avoid the coronavirus, and I have it on the second slide. But what we know for sure, that the coronavirus, the enteric one, can transform to the feline and infectious peritonitis, so can cause the disease FIP. And it depends on the cat. Yeah. Okay, how to avoid the FIP? It's not the 100% like it doesn't avoid the FIP for 100%, but it minimizes the risk. So we should do the early weaning, so up to 5 to 6 weeks. We should isolate the mother and kittens from other cats. When we have, for example, cats in the cat shelter, breed. And of course, it will be perfect to limit the number of cats in the group. And we need to have a good litter box hygiene. We have to remember that cats are very clear and they prefer to use only clear litter box. And we push them to use the dirty one, and it's very stressful for a cat. So when we have more than one cat, we should have the same number of litter boxes than we have cats, or we even one more litter box than cats. What's very interesting also, the coronavirus that is not, for example, in Italy, cats are living wild. There are only like wild cats, let's say. They are domestic, of course, cats, but living outside. And these cats doesn't have the coronavirus antibodies because the infectious is from feces. And when cat is not keeping house and doesn't use the litter box, it's impossible to get the virus from other cat. So like wild cats doesn't have coronavirus, keeping at home cats does. Okay. We have the test, the dual plate. It's antigen antibody test that can detect the antigen from the feces and antibodies from the blood, from serum. We can, using this test, we can estimate the risk of the feline peritonitis. We can like try to free the cat breeding from the virus, and we should examine cats before the adoption, mostly when we try to introduce the new cat to our cats at home. And this table, I think you also have in the catalog of the diagnostic, and it's like the explanation, interpretation of the possible results that we can have. But about the coronavirus, I also have much more information to share with you, and I would prefer to do the very detailed presentation about it and explain everything about this disease. So I will jump to the Giardia now. This test, the VetExpert Giardia test, detects the antigen of Giardia duodenalis. The other name of it is Giardia intestinalis or Giardia lamblia. It's the same Giardia, even if the name is different. Giardia is a protozoan parasite of the small intestine in, I think, all species, all possible species, so rodents, cats, dogs, pigs, ruminants, and humans. It can cause the diarrhea, or it can be without any clinical signs. There are two stages. There is a trophozoite, which is very difficult to find because like outside the is very like delicate, and it's getting destroyed very, very fast. And we have cysts, and the cysts we are searching by tests. The cysts are the time of creation of the cysts is 4 to 5 days. It's important, 4 to 5. I'll tell you later why. So we have one Giardia, but we have many genotypes. And what I would like you to see is that the human is in A1, A2, and B, but also dogs. Yes, the three genotypes are, we have the same with dogs and with human. And guinea pigs. Guinea pigs are, we have to remember about them regarding the Georgia, because they are asymptomatic carriers. So if you have guinea pigs as patients, please check them to the Georgia, because sometimes there is a situation that the dog has the Georgia, and you make the treatment and it repeats, and it's coming back, and the situation is all over again. So, and then you ask the question, do you have any other animals? And they say, yes, we have guinea pig. And this guinea pig is the main cause of the Georgia of our dog. Okay, maybe I'll, Metka asked about the FIP cats. FIP cats, they don't need to have intestinal coronavirus anymore, yes. Not AB and AG. Do you agree? No. I'll tell you in a second. So the test is more important in prevention to see if indoor cats has corona in an intestine or not. So the FIP cats, yes, they very often don't have the antigen in intestine, so in the feces. That the AG antigen test will be negative. And about the AB antibody test, the 30% of the sick cats on the FIP has the low number of antibodies. So the in 30% of cats, the result of the test will be negative, but it doesn't mean the cat doesn't have antibodies. It has, but all antibodies are binded by the antigen. So the antibodies are fighting, yes? So they are busy and they can't be found by the test. So this is the answer why the 30% of cats can have negative result of the test. But these cats, yes, they have antibodies, but it's impossible to find it by the rapid test. But the truth is that VetExpert test, it's not a test to detect the FIP disease. The FIP should be diagnosed by the clinical signs, liquid examination, and cytology, and you can use test also, but it's more for the owner, I mean, than for the veterinarian, because with the liquid, I mean, FIP, yes, because it's much easier to diagnose. So diagnosis of the FIP should be based on the clinical signs and liquid examination. And all of this information, and also the interpretation of the liquid, I have on this presentation about the corona in cats. So this is, I don't put it in this presentation because it's too much information to do on one time. Yeah. Okay, so returning to the Georgia, please remember about the guinea pigs. And how to perform test. This test is one of the most problematic, because very often it clogs up. Because vets are using too much feces performing the test, and the test can just stuck. So how we should do this correctly? We should collect the sample, mix with the diluent, and then just wait 2 to 3 minutes, and the feces will go down, and we have the liquid enough, and we use this, just the clear liquid to perform the test. So I mean supernatant, yes. And how I do in Poland when vets are complaining that the test stuck, I ask them to open the new test and just perform it using the only diluent without the sample. And when they use only diluent and test is going correctly, it means that the test, they used too much feces in this test. So it's because it's very difficult to explain someone that the person performed test in incorrect way. So it was our idea to just ask them to use only diluent, and then they know that they made it on the wrong way. It was much more simple. Okay, and here there is a picture of the classical method, the Lugol's solution stained feces. This is the picture that I made, but I was very, very, very lucky that I found so many cysts. Here you can find cysts in one this slide, because the clinical method is very time consuming and it's difficult to interpret, and even if I looked for many feces in this classical method, I was always afraid that I dismissed something and I didn't feel very comfortable to do this test. But it's possible to do. However, the sensitivity of this classical method is lower, much lower than rapid tests. And on the right, there is a table with the detection level of the VetExpert test. And I will explain you a little bit. However, I disagree to interpret the test on this way, because it doesn't matter how many cysts we have, because we still have the disease. Yes, so we can have a very low number of cysts and very high diarrhea, let's say, and it's not related. But the producer decided to make this detection level. So the detection level of the Georgia test is 125 cysts per 100 microliters. And you have to believe me, but there is a very weak line in here. And here you can see the line. But still, we can see that the control line is much better stained than the test line. And this is the second problem with Georgia, because many clients are asking about this colored line that is very weak, and if they should interpret it as a positive or no. So even the very weak line in this test means that our patient has Georgia. Okay. And I think the last slide of the Georgia is the comparison between the VetExpert or the rapid test Georgia and the classical method. What we know, it's very easy to perform the rapid test, and it's quite difficult, the classical method. In the rapid test, you have the very fast result. Classical method is time consuming. To perform the test, no experience is needed. Only remember to don't put too much feces. And in classical method, the really good trained eye is required to find this cyst in the microscope examination. Rapid test is more expensive, and classical method is cheaper, because you just need the Lugol and salt. Rapid test is more sensitive. More cysts has to be in the feces can be detected by the classical method. And in both methods, feces needs to be stored in the refrigerator, And in my opinion, the weekly samples should be collected. I think the best is to collect 3 samples every 2 days. So, for example, Monday, Wednesday, and Friday, and perform the flotation, searching for other parasites, and the Giardia from the one sample. Andrews asked about, probably you will tell this later. I had a plan, but I don't remember at this moment. Could you please tell how long Giardia AG could be found in feces after the treatment? So it can be found in the feces after the treatment from 10 to 14 days. And I mentioned about 4 to 5 days, and I didn't say about it. Please remember that the like formulating the cysts takes from 4 to 5 days. So this is the answer for the question how long we should make the treatment. Because many vets perform treatment as for the nematodes, so they use it once, 1 day or 2 days, and it's not enough for Giardia. So we have to remember that Giardia we should treat from 4 to 5, even 7 days. Yes, fenbendazole and metronidazole if you prefer. Okay. And once again about this triple tests. Yes, the triple test that we have. So CPV, CCV, Giardia, and FPV, FCOV, Giardia. How to when to perform it. So it gives us the possibility for the more complete diagnosis, and also the estimation of the prognosis. And if we know that we have 2 problems, we know that our treatment should be more aggressive. So in my opinion, it's good to perform this triple test or duo test. We have also CPV, CCV test in our portfolio. Okay, and this is the end of the diarrheas. And now we are jumping to upper respiratory tract infections. Do you have any question about the test that we just finished? Or I will go further. No questions. Okay, thank you, Xavier. So let me start with the canine distemper virus. In Poland, we don't have distemper very often anymore, and it's because of the vaccines. Yeah, the vaccination eliminates this disease from the market. I don't know if you have this disease or no. It was one of the most important disease before, but with the very frequent epidemic with very high mortality rate. And what's important, the virus can be found in all excretions, on the secretions of the infected animal. So it can be in eye fluid, it can be in nasal fluid, it can be in saliva and urine. For the diagnosis, what we have to remember that it can disappear from the eye fluid very rapidly after a few first days. So if you want to perform the test, or you think if you will want to perform the test, it's better to collect the sample at the beginning of the clinical signs, and even wait with this sample like storing in fridge, and you will be able to find it later from the sample collected in first few days. The transmission is through the direct contact, and the virus settles in lymph nodes and multiplies in lymphatic system. Okay, and here are days. It's quite important to remember or to know where to find this information. And viremia is from 3 to 5 days. From the day 14, the virus is found in leukocytes until day 21 in mucosal epithelium. Later, it can be undetectable by the quick tests. So again, the time is important. And clinical symptoms, we have a few options, let's say. We can have respiratory symptoms, intestinal symptoms, so diarrhea, and there are described cases with only diarrhea and the distemper virus found, and skin symptoms. Okay. And adenoviruses, there are two. The first one is the Rubert's disease, so infectious hepatitis. In Poland, we also don't have this disease anymore because of the vaccination. And again, as the same as the distemper, it's excreted by saliva, feces, urine for about 2 weeks, and urine can be even for 6 months. It's possible to have asymptomatic carriers. And this adenovirus type 2 is kennel cough. In Poland, it's quite often. However, what we have to remember is that the virus is only one of the causes. Yes, so kennel cough is it's virus plus many bacteria. It's most frequently found in large groups of dogs, and also transmitted by droplets. It causes the mild respiratory infections, develops after 3 to 6 days. And the local immunity eliminates this virus to 10 days after infection, but it destroys the epithelium. So it's like opening the way from bacteria, and main signs that we can see of the kennel cough is caused by the bacteria. But virus is first, it destroys, and after that we have bacteria. In SIRT3, you can detect both adenoviruses. In the test, because we also have the VetExpert CAV-AG, so just the single plate, and it also detects both types of the of this virus. And influenza, I really would like to know if you have canine influenza in your region. We don't have here in Poland and in Europe. However, I know that in Asia and in Americas it can exist. We are waiting for canine influenza because I'm pretty sure it will appear one day. But what's the history of it? So the first time it was detected in 2004 in a group of greyhounds in Florida, USA. And the virus caused the clinical signs in these dogs was the equine influenza virus, so H398. So it wasn't like the dog species influenza. However, in 2015, in March, again in the United States, many dogs were diagnosed with flu, but caused with the new virus, and it was H2N3. And previously it was found only in Asia. What's important, both viruses belong to the type A of the influenza. as you know, influenza virus is changing very fast. Even the human one is changing, and many strains, let's say, can cause the flu in human. So in Poland and Europe, we still don't have it, but I'm pretty sure we are just waiting for it, and it will appear. And about the influenza, a few more things. Also transmitted by droplets, so coughing and nasal fluid. And secretion of this virus is from 2 to 4, I mean, the incubation period is from 2 to 4 days. And then the largest amount of the virus is excreted. What's a little bit terrifying is that the virus can survive on the surfaces for 48 hours and 24 hours on clothes and 12 hours on human hands. There is a small difference there are differences between these two types of viruses, because you can see that the equine one, the excretion time is shorter, and the dog species one is 26 days. So like the best way how to treat the dog is to keep the dog at home for about 3 to 4 weeks. Clinical symptoms are the same as in human flu. And what's interesting also, the dog's flu, the H3N2, can cause the disease in cats too. So regarding this search test, so respiratory disease diagnosis is a dual plate, but with 3 diseases. So there is on the upper line window, you have one control line and 2 test lines, T1 and T2. And in the window below, you have only influenza, so there is one disease to detect. So because many customers, when firstly open the plate, are confused because there are 3 diseases and just 2 windows. So yes, because there is T1 and T2 in the upper window. Okay, now I would like to shortly introduce you the total IgE test. I choose this test because it's not our best seller, and I think we have to build the market for it because it's quite useful, and in Poland we use it. And our key opinion leader of the dermatology, the same who made the sprays, the moisturizing spray and hotspot spray from the cosmetic line, she made the scheme how to use this total IgE test, and I have it at the end of this part of total IgE test presentation. So the test is for preliminary atopy diagnosis. Few words about the atopy and food allergy. What's the main difference? In the atopy, we have clinical signs on the skin, but it's the reaction to the antigens of the inhalant. So it's usually genetic, and most frequently it's found in young animals. And it's not seasonally. It depends, because it depends on what the dog has allergy. So if it's for example, trees or grasses, it can be seasonally, but if it's on the dirt, it's non-seasonally. And the main clinical signs, it's itching, ears, paws, and very often entire body. It doesn't respond to the elimination diet. And food allergy is a skin reaction to the food. Atopy is much more often than the food allergy. But the atopy can be like together with the food allergy, and this is the most difficult cases. So also itching, rash, and redness. The food allergy can be resistant for the steroids, but it responds very good for the elimination diet. And tests that we can use to detect for the diagnosis of allergies. So there are two types of tests. Intradermal tests. It's quite difficult to perform because it's not very nice for a dog, because it's like put the needle to the subcutaneous tissue. So many dogs has to be like with the anesthesia to perform this test. Of course, it depends on the dog's behavior, but it's not easy even to perform. And what's important, the animal firstly need to be take off the steroids. It's not sufficient for food allergies. It's quite expensive, and as I mentioned, the sedation is required to perform. And blood test is much more easy to perform. It's because it's just collecting the blood. If the steroids should be take off, it depends on the doctor. Some doctors thinks and declare it should be like do the 4 to 5 weeks gap of steroids. Some perform the test on steroids therapy too. And very often we can find false positive and negative results. Mostly false positive results are found, and it's also quite expensive. But regarding our total IgE, when and how to use this test. This test will detect all like the sum of all IgE from the body. So it will be like summarizing effect, because very often the allergy is for many things, but the level is small. Yeah, so the test of total IgE is searching for the like summing the effects. So we have it in here. And it also causes the clinical symptoms when the effects are summed. So the total IgE is the first step of the allergy diagnosis. You can perform it on the first visit to just like consider if the dog has or doesn't have the allergy problem. What's important and what we have to remember is that at the beginning we have to eliminate all bacteria and fungal infection and parasites. And then we have only food allergy, contact allergy, insect bites, and atopic dermatitis. So this is the scheme from the producer, but I will skip it and I will return to the scheme that this key opinion dermatologist performed to us. Okay. So it's the initial allergy diagnosis during the first visit. And if we have positive result, we have the atopy or food allergy. We introduce the elimination diet and repeat the test after 4 to 6 weeks. And if the result will be negative, we know that it was a food allergy. It couldn't be the atopy. And if the result is still positive, we have both atopy and food allergy, because some food allergy are total IgE like sensitive. So on the scheme, IgE test on the first visit, positive result, 4 to 6 weeks elimination diet, repeat. Negative, we know it's not. We know it's not atopy; it's a food allergy, and we are like our way is to diagnose the food allergy and the reason of it. And if the result is still positive, we have atopy, or we have to remember about this food allergy too. But we are closer to the atopy diagnosis. Okay. And now I have just few slides, like one slide per one test. And this is the last test of pets. And we have feline T4 test. I don't know if you know about this test. It's the screening test of older cats. It detects the higher concentration of thyroxine, and it's semi-quantitative test. And in here on this slide, you can see the interpretation of the test. So we have 3 options. This is it can be quite difficult because this test you read on the just another way. So appearing the test line means the test is negative. So it's like on the other way. The first picture in here, so we don't have test lines. It means that the level of the thyroxine is higher than 80. If you have only one line on 80, we know the level is above the 40 to 80. And if we have all lines, so 2C and 2T lines, it means that the cat is healthy. So the level of thyroxine is lower than 40. Okay, so it's just the screening. In my opinion, this test is very good fitted for the clients who doesn't have the like easy, it's not easy to reach to the laboratory. So it can be a first like screening test for cats. IgE, can you repeat the weak line is positive or negative? Yeah, it's a difficult question because the producer of the test declared the test can be, if it's weak, it should be repeated, and it can not say about the atopy. But the key opinion leader, so Joanna Karaś-Tęcza, who performed the like evaluation of this test, she diagnosed about 190 dogs, and she declares that all lines, even weak line, she read as a positive line. And so even the weak line should be determined as a positive result. Okay. I think you also have this evaluation should be translated to English, and it's in Veterinary Life, the dermatology Veterinary Life describe this evaluation. Okay, and now a few words about the bovine diagnostic tests. I like cattle very much, so and I like these tests. So we have, I will begin from the bovid-4 and cryptosporidium. I will tell about this test together because the cryptosporidium is one of the diseases that we can detect by the bovid-4. So there is no difference about the cryptosporidium from the single and the quadruple test. So the bovid-4 is a quadruple test for differentiation of the calf diarrheas. It all detects antigens of few diseases. So E. coli K99, our new name is F5, rotaviruses, coronaviruses, and cryptosporidium in cow feces. And crypto is a single plate to detect the cryptosporidium. The result of the test, we should interpret it in the other way than in pets, because in pets, for example, FELV test means that the cat is sick. Just one single cat is sick and is diagnosed by the one single test. And here with the cattle, the result of BOVID4 gives us information about the entire herd. It's not the one test per one calf, it's one test per one herd. So one test is for all animals and gives us information how we should proceed our prevention in whole herd. So E. coli positive result. It's just this ETETS strain type. It's better to say type. Is indicative to the poor quality of the colostrum or incorrect hydration by the colostrum of the cow. Crypto requires the targeted therapy, not only of the affected animals, but the whole group. Rota corona, we know that the disinfection is necessary. And what we have to remember is that if we have E. coli, rota, or corona, we have vaccines. So the cows in dry period can be easily vaccinated by the vaccine, and it prevents the it prevents the diseases in the calves or limitate the clinical signs. And on the picture, rota, corona, E. coli. What we know, we should do the symptomatic treatment, immunization of the cows in dry period. If we have rota corona, it means disinfection is needed. And if we have E. coli, we have to check the quality of the colostrum. And again, positive result is the whole herd diagnosis, not just the one calf. And crypto, if we have the positive crypto, the treatment against the cryptosporidium is needed. We should, of course, do the symptomatic treatment and the disinfection too. And a few positive results: crypto, corona, crypto, and here very weak, but it's visible. We have crypto, we have corona, and we have E. coli. So the situation on this herd is not perfect. And the last test for cows, however, off the record also, the Clostridium perfringens can be a cause of diarrhea in other species too, also dogs. And but this test is dedicated for the livestock, so calves, so piglets, and other ruminants. So Clostridium perfringens, diagnosis of diarrhea in young animals. This test detects the fragment of bacteria and alpha toxin of Clostridium perfringens. About this test, I can also say about many things because it's quite complicated to explain. But I will leave it for the cattle presentation for later. And important information: detection limit is 10 to 5 CFU, so colony forming units per gram. Because Clostridium perfringens in very low level you can find in healthy animals too, but you can't find the alpha toxin, because alpha toxin means it's bad and the animal is sick. Okay, other diagnostic products in VetExpert portfolio. I don't have any more slides about it because it's again too much things to say. So Eurotest 11, so just Euro strips. Urine strips can be used in all species. Vet glucometer we have for cattle and we have for pets. We have gluco and ketone strips. With ketones, we think about cows when we think about ketones. But also interesting thing is that ketosis can appear in pregnant guinea pigs, again, guinea pigs. So even guinea pigs can be diagnosed by the ketone strips. Refractometer, so the machine to detect the quality of the colostrum inter alia, and pH vet, so just pH strips. This is the diagnostic topics proposal. This is my proposal of the topics we can talk about. We can put them together, for example, to don't make that many trainings. We can, for example, do the corona and respiratory diseases together, so it will be 1 hour period. And but it depends on you. I think Richard will share with you this information, and you have the possibility to tell what you prefer. And I see Richard is coming on the screen, so I will give him the mic now. Thank you very much for this training, for being here with me. I hope it wasn't too boring for you, because diagnostic is not very interesting and it's quite difficult. And thank you again.
I'm just wondering if you can hear me.
Yeah.
Hopefully. What do you think if we can just have a brief look at the questions to make sure that all of them have been answered, just in case? I think you addressed all of them, but just to make sure. Yeah, that is actually a question to answer by me. With regard to the presentations, for sure, the presentations and material, the video recording will be made available to you after the session. The video is itself made available by the system. You get an auto reply. The presentations in PDF. I think there's no reason why we shouldn't make it available to you as well. So just wait for an email. We will send the link. Another question that we had. I was not sure about that one. It's not added in the event board.
I think it was at the first when I shared the screen, and it was needed to refresh the program.
So it's done.
Mm-hmm.
And the rest of the questions, Natalia, I think I'm not sure, but
I think I answered to all questions. There is just the last one that just appears now. That customer says that when you open a new FCO-VAB test, you can already see both lines. My comment is that this test is incorrect and valid. What I need is the information if all tests are the same. What is the lot number and expiration date, and I need this information on email, and of course we will do the complaint about it. The main reason is sometimes the test, there is a like the pochłaniacz wilgoci.
Absorber, right? Like moisture
absorber, sorry.
Maybe?
So there is the absorber inside the sachet, and maybe it was invalid. So the test absorbed the like the oxygen from the earth, and then the two lines appeared. But still, the test is invalid. So we have to just change it.
Okay, and well, thanks. Yeah. So, well, my mission at the very end of the session is basically to draw your attention to one fact that the academy is a new concept for us. It's in fact like a newborn baby, so it needs parents. So we will be asking for more and more feedback. If that's not a problem, just don't try to be very, very brief. Let us know what you're thinking about any kind of aspect of these 3 sessions that we already covered. Without you, there's no academy. So just be back to us. And what else? Well, we're working now very hard to prepare a list of other topics. Natalia's already disclosed some of them. We will be sending you some more information on the next sessions. That's more or less it, I think. Thank you, Natalia, for making this lovely, comprehensive session. Thank you, Michał, if you're with us anywhere there, for the 2 previous days. And well, if there's no more questions, see you probably in the next coming weeks. Okay. Thank you.
Thank you very much.
All the best.